Good morning. In this class, we will start a new chapter, Neoplasia. First, introduction and definition of neoplasia, followed by nomenclature of tumors and characteristics of benign and malignant tumors will be discussed in this class. The word neoplasia means new growth, and the new growth is called as a neoplasm or tumor. The study of tumors is known as oncology, and it is derived from a Greek word onkos means tumor. The eminent British oncologist R.A. Willis defined the neoplasm as an abnormal mass of tissue, the growth of which exceeds and is uncoordinated with that of the normal tissue and persists in the same excessive manner even after the cessation of the stimuli which evoked the change. The persistence of tumors even after the inciting stimulus is gone results from the genetic alterations which are passed down to the progeny of the tumor cells. And these genetic alterations allow excess and unregulated proliferation that becomes autonomous. A meeting of autonomous is independent of physiological growth stimuli. That's why even after the stimulus is not there, the tumor cells will proliferate. All tumors, whether benign or malignant, have two basic components. The parenchyma, it is made up of proliferating tumor cells, and supportostroma, it forms the framework of the tumor. And this supportostroma, it is made up of connective tissue, blood vessels and variable numbers of the cells of the adaptive and innate system. The classification of the tumors and their biological behavior are based primarily on the parenchymal component, and the growth and spread is critically dependent on the stromal component. Tumors are classified into two types, benign tumors and malignant tumors. Characteristics of benign tumors. The benign tumors are slow growing and usually they are capsulated and spherical in shape, well circumscribed, freely mobile, firm and in consistency and uniform. And they are relatively innocent and remain localized so that they are amenable to local surgical removal. In general, benign tumors are designated by attaching the suffix "oma" to the cell of origin. Tumors of the mesenchymal cells generally follow this rule. Benign tumor arising from the fibrous tissue is known as fibroma, and benign cartilaginous tumor is known as chondroma. The nomenclature of epithelial tumors is more complex, and it is derived based on the cell of origin as well as macroscopic architecture and microscopic pattern. And examples of benign tumors. The benign tumor made up of adipose tissue is known as lipoma, and the benign tumor of fibrous tissue is fibroma. Likewise, the benign tumor made up of bone is osteoma, and benign cartilaginous tumor is called as chondroma, and benign epithelial neoplasm derived from the glands is called as adenoma, and benign epithelial neoplasm producing macroscopically and microscopically visible finger-like projections from the epithelial surfaces are referred as papillomas. See, this is the microscopic picture of benign thyroid adenoma, in which the cells are arranged in the form of follicles, and in the lumen of the follicles they are filled with colloid. Malignant tumors are collectively referred to as cancers, and it is derived from the Latin word for crab. Like that of a crab, they tend to adhere to any part and they seize on in an obstinate manner. And the characteristics of malignant tumors are they are rapidly growing and they are not encapsulated and they are very poorly circumscribed and irregular in shape and firmly attached to the underlying structures, and the consistency may be hard or very soft. And they are dangerous and they cause invasion and destruction of the adjacent structures, and they spread to distant areas. It is nothing but metastasis in the future of malignant tumors, so that it will cause death of the patient. Malignant tumors are classified into two types, carcinomas and sarcomas. If it is from the epithelial origin, it is called as carcinoma, and if it is derived from the mesenchymal origin, it is called as sarcoma. Examples of malignant tumors. Examples of carcinoma are adenocarcinoma, squamous cell carcinoma, and examples of sarcomas are liposarcoma and fibrosarcoma. Usually malignant tumors will end as carcinoma and sarcomas. with few exceptions are there. For example, malignant tumor of testis, it is called as seminoma, And malignant tumor of skin derived from the melanocytes, it is called as melanoma. See, this is the microscopic picture of adenocarcinoma in which the cells are arranged in the form of glandular pattern. See, this is the microscopic picture of squamous cell carcinoma in which the cells are arranged in the form of net sheets. And the arrow is there, no? Here it is focusing the central keratin pearl within the nest of the pleomorphic squamous cells. So this is the microscopic picture of fibrosarcoma in which the malignant spindle cells are arranged in the form of herringbone pattern. Divergent differentiation of a single neoplastic clone creates a mixed tumor. And these mixed tumors contain epithelial component as well as mesenchymal components like myxoid stroma, and islands of cartilage and bone can also be present. Example of a mixed tumor is pleomorphic adenoma. It is a benign tumor of salivary gland. This is the microscopic picture of pleomorphic adenoma, and the epithelial cells form the ducts and also arranged in the form of cords. And also mesenchymal components like myxoid stroma and areas of cartilage is also seen. Next one is teratomas. In teratomas, the cells originate from two or more germ layers. That means it contains components of ectoderm, mesoderm and endoderm. Such cells can differentiate into any of the cell types like bone, epithelium, muscle, fat, nerve and other tissues. The common sites for the teratomas are ovaries, testes and in the midline in the mediastinum. Teratomas are of two types. Mature teratoma is benign and immature teratoma is malignant. This is the gross picture of open mature cystic teratoma of ovary. It is also called as dermoid cyst. Note the presence of tuft of hair along with sebaceous material and tooth. This is a microscopic picture. Here you can see the tissue lined by stratified squamous epithelium and also the lumen filled with keratinous material, and also hair shafts will also be there. And also in the left side you can see the adipocytes along with pilosebaceous unit. I would like to add few important conditions here. One is hamartoma, another is choriostoma. Hamartoma is nothing but disorganized but benign masses composed of cells indigenous to the involved site. It is called as hamartoma. Example of hamartoma is hamartoma of lung and vascular hamartoma. Next one is choriostoma. It's nothing but heterotopic rests of cells. That means presence of normal tissue in an ectopic site is choriostoma. For example, presence of pancreatic tissue in the submucosa of the stomach, duodenum and small intestine is called as choriostoma. This is the tabular form showing the nomenclature of benign and malignant tumors. Benign tumors usually it will end with myoma. So if it is a malignant tumor and if it is derived from the mesenchymal origin, it will end with sarcoma. For example, fibroma is benign and fibrosarcoma is malignant. Lipoma it's a benign tumor. Liposarcoma it is malignant. Likewise, benign tumor of smooth muscle is leiomyoma and malignant counterpart of smooth muscle is leiomyosarcoma. And a benign tumor of striated muscle is rhabdomyoma and malignant counterpart of striated muscle is rhabdomyosarcoma. Usually for benign tumors it will end with oma. So if it is derived from the mesenchymal origin, the malignant tumors it will end with sarcoma. With few exceptions are there. For example, malignant tumor of mesothelium it is called as mesothelioma, and malignant tumor of brain covering is nothing but invasive meningioma, and malignant tumors of hematopoietic cells are leukemias, and lymphoid tissue it is nothing but lymphomas. And if it is derived from the epithelial origin, benign tumors it will end with oma. For example, squamous cell papilloma is benign, whereas squamous cell carcinoma is malignant. So if it is derived from the epithelial origin, so malignant tumor cells will end with carcinoma. And adenoma is benign tumor and adenocarcinoma is malignant. So usually it will end with oma for benign tumors, and carcinoma if it is derived from the epithelial origin, the malignant tumors will end with carcinoma. Some exceptions are there. For example, malignant tumor of testes it is called as seminoma. And next one, malignant tumor of skin derived from melanocytes it is called as malignant melanoma. Next one is mixed tumor. Benign one it is pleomorphic adenoma, and malignant one it is a mixed tumor of salivary gland is the name for the malignant mixed tumor of salivary gland. Next one is teratomas. It is of two types, mature and immature. Mature teratoma is benign, it is also called as dermoid cyst, whereas malignant teratoma it is a immature teratoma. Other name for this is teratocarcinoma. Loss of differentiation is an important feature of anaplasia. So before going to the what is loss of differentiation, first we should know what is differentiation. Differentiation refers to the extent to which the neoplastic parenchymal cells resemble the corresponding normal parenchymal cells both morphologically and functionally. Deviation, it can be either minimal or extreme. If there is minimal deviation or sometimes if the tumor cells are similar to the normal cells, it is called as well differentiated tumor. So if the deviation is extreme from the normal cells, it is called as poorly differentiated or undifferentiated tumor. In between, it is called as moderately differentiated tumor. Usually benign tumors are well differentiated, whereas malignant tumors, they exhibit wide range of differentiation. That means it can be either well differentiated or moderately differentiated or poorly differentiated. So this is the microscopic picture of well differentiated adenocarcinoma. Left side picture, the tumor cells resemble like that of the native tissue origin. The tumor cells here they are arranged in the form of glandular pattern. That's why it is called as well differentiated adenocarcinoma. The right side picture, it is a moderately differentiated adenocarcinoma. That means both glandular pattern as well as infiltrating cords and sheet pattern is there. As some glandular pattern is retained, it is called as moderately differentiated adenocarcinoma. Next is poorly differentiated adenocarcinoma. See here there is no glandular pattern, only the tumor cells are arranged in the form of sheets. That's why it is called as poorly differentiated adenocarcinoma. Lack of differentiation is anaplasia. Anaplasia is a hallmark of malignancy. The term anaplasia means to form backward, implying a reversal of differentiation to a more primitive level. Lack of differentiation or anaplasia is often associated with many other morphological changes. Now we will see the morphological changes of anaplasia one by one. First is pleomorphism. The meaning of pleomorphism is variation in the size and shape. Not only cellular pleomorphism will be there, but also pleomorphism in the nucleus is also seen. Next is tumor giant cells. The tumor giant cells can be either single large polymorphic nucleus can be seen, or sometimes two or more large hyperchromatic nuclei are also seen. In the adjacent picture you can see the pleomorphism of the cells as well as in the nuclei. And also many nuclei are there, no, it is nothing but it is a tumor giant cell. In this picture also you can see marked cellular and nuclear pleomorphism. See the difference in the sizes of the cells as well as in the nuclei. The other features of anaplasia are abnormal nuclear morphology. The nuclear to cytoplasmic ratio in the normal cells is 1:4 to 1:6. But here in anaplasia, the nuclear to cytoplasmic ratio is increased. That means in the ratio of 1:1. And the nuclear shape is variable and irregular, and also nucleoli can also be seen. In the adjacent picture you can see in some cells there is increase in the nuclear to cytoplasmic ratio, and also you can appreciate the difference when comparing with that of the other cells. And also some nucleus it is showing nucleoli also. The chromatin is coarsely clumped and often distributed along the nuclear membrane. The nucleus is hyperchromatic because the nucleus is darkly stained when compared to the normal nucleus. In the adjacent picture you can see the hyperchromatic nuclei. Next one is loss of polarity. Loss of polarity is nothing but orientation of anaplastic cells are markedly disorganized. Next one is other feature of anaplasia is central ischemic necrosis. Usually growing tumor cells they obviously require blood supply, but often vascular stroma is insufficient. As a result, the rapidly growing malignant tumors they develop large central areas of ischemic necrosis. So in this adjacent picture you can see the ischemic necrosis in the lower half. The cells are there in the upper, but in the lower half you can see the ischemic necrosis. Next is presence of mitotic figures. Mitotic figures indicate high proliferative activity in the tissues. These mitotic figures are also seen in the normal tissues. But whereas in anaplastic cells, that means in malignancies, atypical and bizarre mitotic figures are seen, sometimes with tripolar, quadripolar or multipolar spindles. In the adjacent picture in the center you can see the mitotic figure with tripolar spindle. This is the picture showing the difference between normal cell and anaplastic cell. Left side one is normal morphology, right side one is anaplastic morphology. In normal morphology, usually the basal polarity is retained and there is no pleomorphism and the NC ratio is low and there is no anisonucleosis and the chromatin is normal, nuclei are normal and normal mitotic figures and no tumor giant cells. The cytoplasm is normal and chromosomal shows diploidy. Next, in this anaplastic morphology, it will show loss of basal polarity and there is pleomorphism of the cell and increased NC ratio and there is anisonucleosis and the nucleus is hyperchromatic and the nucleoli are prominent and abnormal mitotic figures and presence of tumor giant cells and there is increase in the mucin and DNA shows aneuploidy. So this is the tabular form showing the differences between benign tumors and malignant tumors. So in the benign tumors, the boundaries are encapsulated and well circumscribed, whereas in malignant tumors, they are poorly circumscribed and irregular. Surrounding tissue is compressed in benign tumors, whereas in malignant, they are invaded. The size is usually small in benign tumors, whereas in malignant tumors, it is often larger. Secondary changes are less often in benign tumors, whereas more often in malignant tumors. The pattern resembles the tissue of origin in benign tumors and poor resemblance to the tissue of origin in malignant tumors. And basal polarity is retained in benign tumors, whereas it is often lost in malignant tumors. Pleomorphism is not present in benign tumors, whereas in malignant tumors it is present. And the NC ratio, it is normal in benign tumors, whereas in malignant tumors it is increased. Other features are anisonucleosis and hyperchromatism is absent in benign tumors, whereas it is present in malignant tumors. And typical mitotic figures in benign tumors, whereas in malignant tumors, atypical mitotic figure in malignant tumors. Next one is tumor giant cells and chromosomal abnormalities are absent in benign tumors, whereas present in malignant tumors. And the function is well maintained in benign tumors and it is usually lost in malignant tumors. Growth rate is low in benign tumor, whereas it is rapid in malignant tumor. Local invasion metastasis is absent in benign tumors, whereas it is present in malignant tumors. Prognosis, benign tumors it will produce local complications, whereas malignant tumors it will produce death by local and metastatic complications. Till now I discussed about this anaplasia. Now I would like to add a few important conditions here. First one is metaplasia. Metaplasia is nothing but replacement of one type of cell with another type. Metaplasia is usually found associated with tissue damage, repair and regeneration. One of the example of metaplasia is in case of gastroesophageal reflux, which damages the normal squamous epithelium of the esophagus and is replaced by glandular epithelium, and this glandular epithelium it is more suitable to a more acidic environment. Next one is dysplasia. Dysplasia is a term that literally means disordered growth and usually it is encountered primarily in the epithelium. The characteristics of dysplasia are loss in the uniformity of the individual cells along with loss in their architectural orientation. That means the architecture of tissue is disorderly, and the other features are pleomorphism along with large hyperchromatic nucleus and there is increased nuclear to cytoplasmic ratio. Next one is carcinoma in situ. When the dysplastic changes are marked and involve the entire thickness of the epithelium, it is called as carcinoma in situ or pre-invasive neoplasm. Here in carcinoma in situ, the tumor cells it won't penetrate the basement membrane. So once the tumor cells penetrate the basement membrane, it is called as invasive neoplasm. So this is the low power view. In the left side picture is the low power view of carcinoma in situ. Here you can see the dysplastic cells involving the entire thickness of the epithelium. This is the right side one is high power view. Here you can see the loss of normal differentiation of cells along with marked cellular and nuclear pleomorphism, and numerous mitotic figures are there extending towards the surface. Thank you.